Dermatological Conditions, Chapter 29. For the purposes of this lecture, we will discuss different skin disorders, including their definition, the signs and symptoms of the condition, and the mode of transmission. All skin conditions should be referred to a physician for examination and treatment. A macula is a change in surface color without elevation or depression. They come in various sizes, usually 5 to 10 millimeters in diameter. They are most common on the back, chest, arms, and face. They can be hypopigmented or hyperpigmented skin tissue. A birthmark may be considered if it is small. Rashes may also be considered if the color of the rash is varied from the skin, for example in cafe au latte spots. If they are lesions, they may spread. Vitiligo is a disease that causes the loss of skin color and blotches. This may also include skin cancers or ultraviolet light exposures, also called age spots. A papule is an area of abnormal skin tissue. They are typically less than 1 centimeter. They have distinct borders and come in a variety of shapes. They may have skin lesions and essentially are changes in the skin color or texture of your skin. Papules can cluster together to form a rash. They are caused by a number of skin conditions, most commonly dermatitis, chickenpox, and eczema. They can be relieved with home treatments. Papules appear sometimes with new medication, and you should consult your doctor. A papule may also appear from a tick bite. You need to consult a doctor to determine if you have Lyme disease. A nodule is a growth that forms under the skin. They may be filled with inflamed tissue or a mix of tissue and fluid. They may have colored fluid within the nodule, which may indicate an infection. Inflamed tissues that collect together may form a lump. They can grow within any level of the skin, either the subcutaneous layer, the dermal, or the epidermal layer. They are sometimes found on the body's organs as well. They may range in size. They can be cancerous or non-cancerous, but most are benign. Common areas for nodules include the thyroid glands, lungs, underarms, and groin. A tumor is any mass lesion or abnormal growth of body tissue. It's generally larger than a nodule. It may either be malignant, cancerous, or benign, non-cancerous. Signs and symptoms include weight loss, persistent headaches, chronic fatigue, nausea, and vomiting. Different things that can affect the modes of transmission of tumors include diet, genetics, which include a family history, the environment, excessive sunlight exposure, obesity, and radiation. Some tumors are more common in one gender than another. A plaque is a usually well-circumscribed lesion with a large surface area and slight elevation. Signs and symptoms include red and scaly skin, crusting of the scalp, discoloration of the fingernails. Causes or transmission of the disease include stress or trauma from streptococcal infections, abnormality to immune systems. Certain medications and drugs may aggravate the condition. This may also be genetic. A wheal is an elevation of the skin with smooth surfaces, sloping borders, and light pink coloring. They're caused by acute areas of edema in the skin. They may appear, disappear, or change form abruptly within hours or minutes. Their size ranges from 3 to 20 centimeters. Signs and symptoms may be an allergic reaction. They're typically red or pink in color. Smooth elevations around the surrounding skin. Itchiness or irritation may occur. They may occur frequently or unpredictably. The mode of transmission for a wheal is pain medication, scratching, temperatures either too hot or too cold, stress, sunlight, and sometimes exercise. A vesicle is a raised lesion less than 1 centimeter in diameter. They are typically filled with clear fluid. Signs and symptoms may include allergic reactions to drugs, atopic dermatitis or eczema, autoimmune disorders, chickenpox, poison ivy, herpes simplex, or shingles. For the mode of transmission, they are possibly contagious when the blisters pop and may spread to other areas. A bullula is a large blister on the skin. It's often filled with clear fluid. Signs and symptoms include insect bites, infections, burns, the herpes simplex virus, or allergic skin reactions. Mode of transmission is very similar. It may be contagious if they break open and leak onto surrounding skin tissue. A pustule is a small pus-filled sac. It's commonly seen in acne. This is an infection on the skin. Signs and symptoms include chickenpox, yeast infection, and a herpes viral infection such as cold sores or genital herpes. The mode of transmission may also be contagious if they break open and leak onto surrounding skin. An erosion is a loss of some or all of the epidermis or the outer layer of the skin. The signs and symptoms include eating away of the surface layer by chemical or a physical process such as inflammation. The mode of transmission is not contagious, so if somebody has an erosion, you are not likely to catch it from them. An ulcer is a sore on the skin or a mucous membrane. It is a disintegration of tissue. It can result in a complete loss of the epidermis and often portions of the dermis and even subcutaneous fat. The signs and symptoms of ulcers is they appear as open craters, often round with layers of skin that have eroded. The skin around the ulcer may be red, swollen, and tender. Patients may feel pain on the skin around the ulcer and fluid may ooze from the ulcer. The mode of transmission for ulcers may be contagious if they're oozing. A fissure is a crack in the skin. It is most commonly the result of skin dryness. Ichthyosis is a genetic disorder where there's often severe skin cracking. Signs and symptoms are linear-like cleavages of the skin, sometimes defined as extending into the dermis. They are smaller than skin lacerations. A fissure is not contagious and there is no mode of transmission. Atrophy of the skin is a thinning of the upper layer of the skin, which is often caused by aging or topical steroids. Signs and symptoms of atrophy include tension or tightness of the skin, pain, pitting, dryness, or a papery texture of the skin. Again, atrophy is not contagious and there is no mode of transmission. Excoriation or neurotic excoriation are skin lesions produced by repetitive scratching. There is no known underlying physical pathology. Patients dig at their skin to relieve itching, to extract imaginary objects that they believe are embedded or extruding from the skin. Signs and symptoms include clear linear erosions, scabs and scars that are hypopigmented or hyperpigmented. All lesions are usually of similar size and shape. Common sites include exterior surfaces of the extremities, the face, and the upper back. There is no mode of transmission and excoriation is not contagious. A crust or scab is serum, blood, or purulent exudate which dries and is a hallmark of a pyrogenic infection. Signs and symptoms of a crust can be yellow when they have arisen from dried serum, green or yellow. Signs and symptoms of crusts can be yellow when they have arisen from dried serum, green or yellow-green when formed from purulent exudate, brown or dark red when formed from blood, and the mode of transmission is none, so these are not contagious either. A scale is dry, itchy, or red, flaky skin. Signs and symptoms include that dry, itchy, or red, flaky skin. They can look like fish scales or alligator skin. Associated conditions are psoriasis, dermatitis, eczema, and ichthyosis vulgaris, which is fish scale disease. Scales are not contagious and therefore do not have a mode of transmission. Lichtenfunication is a thickening of the skin due to continuous scratching or rubbing. The skin will have a leathery appearance and is associated with skin conditions in which the skin is continuously irritated, such as eczema. There is no mode of transmission and lichtenfunication is not contagious. A scar is a patch of skin that grows over a wound. It forms after the body heals itself from cuts, scrapes, and burns. It can also be caused by surgery, chickenpox, acne, and tuberculosis tests. Scars, too, are not contagious and therefore do not have a mode of transmission. A keloid is a growth of excessive scar tissue in which the skin has healed after an injury. Signs and symptoms may include areas that may be flesh-colored, pink, red, or purple, a lumpy, rigid area of skin, itchy patches of skin, and the scar tissue may continue to grow larger over a period of time. Keloids are not contagious, but the exact cause is unknown and may be most common in darker skin-toned people due to injury, either avulsions or surgical trauma and piercing. Urticaria is also known as hives. They are red, often itchy, red welts on the surface of the skin. It's usually an allergic reaction to food or medicine. Signs and symptoms include slightly raised, pink or red swelling on the skin, welts that occur alone or in a group or connect over a large area, Skin swelling that subsides or goes away within 24 hours at one spot but may appear in another spot, itching, and burning. The mode of transmission can be allergies to food, dust, animal, and insect bites, infections to illness such as the cold or the flu, exposure to sun, stress, pressure on the skin or scratching, and contact with chemicals. Dermatographism is one of the most common types of urticaria or hives, in which the skin becomes raised or inflamed when stroked, scratched, rubbed, or sometimes even slapped. This is also known as skin writing. Signs and symptoms include red raised lines, swelling, infection, hive-like welts, and itching. There is no exact cause, and the mode of transmission is not contagious. This occurs mostly from rubbing of clothes or bed sheets. Dermatographism may also proceed from an infection, stress, or medication such as penicillin. Cholera-genic urticaria is 4 to 6 millimeter hives which develop after exposure to heat, exercise, or stress. This is sometimes referred to as an exercise allergy. Signs and symptoms include itching, burning, tingling, and warmth of the skin. It may last minutes to hours. It is not contagious, but exposure to sun, heat, and exercise will increase the welts. Cold urticaria is hives which occur after exposure to cold. Many occur after infections, medications, or emotional stress, and is most common in patients 18 to 25 years of age. The signs and symptoms include hives, which usually develop within 5 minutes of exposure and may last 1 to 2 hours after exposure to cold. The mode of transmission is exposure to cold, but cold urticaria is not contagious. Solar urticaria is hives that occur within minutes of being exposed to UV light. This is also known as a sun allergy. Signs and symptoms include hives after exposure to sun, which resolves within 1 to 3 hours. The mode of transmission is exposure to UV light or the sun. Solar urticaria is not contagious. A sebaceous cyst is a closed sac under the skin that is filled with a cheesy-like or oily material. Signs and symptoms include a small, non-painful lump beneath the skin. This usually grows slowly and is not typically painful. Warmth of the skin may occur in an infected area. The cyst may have a grayish-white, cheesy, foul-smelling material that drains from the cyst. Most commonly, they are found on the face, neck, and trunk. If the lump becomes infected or inflamed, other symptoms may include skin redness and tender or sore skin. The mode of transmission is not contagious. However, draining these sebaceous cysts is very important to prevent future infections. Eczema is a generic term for a skin inflammation. It affects 10 to 20% of infants and about 3% of adults. Most infants outgrow this condition into adulthood. Signs and symptoms include itchy skin. Stress tends to cause the condition to worsen. Modes of transmission include family history and other allergies or asthma. Psoriasis is a skin redness and irritation. Most people have thick red skin with flaky silver-white patches or scales. Signs and symptoms can be acute or chronic. This includes scales, and other symptoms may include genital sores in males, joint pain or aching, nail changes, severe dandruff on the scalp, and is most often seen at the elbows, knees, and the middle of the body. The mode of transmission is not contagious for psoriasis. A melanoma is the most dangerous type of skin cancer. It is the leading cause of death from all skin diseases. It can involve the colored part of the eye as well. Signs and symptoms include a mole, sore, lump, or growth on the skin, a sore or growth that bleeds or changes in color. The ABCD system can help you remember the possible symptoms of a melanoma. A stands for asymmetry. One half of the abnormal area is different from the other half. B stands for border. The edges of the growth are irregular. C stands for color. Color changes from one area to another with shades of tan, brown, or black, or sometimes white, red, or blue. A mixture of colors may appear within one sore. D stands for diameter. The spot is usually, but not always, larger than 6 millimeters in diameter, or about the size of a pencil eraser. E stands for evolution. Does the mole keep changing in appearance? Melanomas are not contagious and therefore have no mode of transmission. Impetigo is a skin infection. It is usually caused by the Streptococcus or Staphylococcus bacteria. It can also be caused by methicillin-resistant Staph aureus or MRSA. Signs and symptoms include blisters that are filled with pus and are easy to pop. They may be reddish or raw looking where a blister has broken. Skin sores on the face, lips, arms, and legs that spread to other areas, and swollen lymph nodes near the area of the infection. For the mode of transmission, the skin normally has many types of bacteria. The skin breaks can allow bacteria in, and breaks in the skin can occur with animal bites, human bites, injury and other trauma to the skin, and insect bites. Impetigo may also occur on the skin where there is no visible break. It is most common in children who live in unhealthy conditions. In adults, it may occur following another skin problem and may develop after a cold or another virus. Impetigo can spread to others. You can catch the infection if the fluid that oozes from the blisters touches an open area on your skin. Cellulitis is a common skin infection caused by bacteria. Signs and symptoms include fever, pain or tenderness in the affected area, skin redness or inflammation that gets bigger as the infection spreads, skin sores or rash that grows quickly or suddenly in the first 24 hours, tight, glossy, stretched appearance of the skin, warm skin in the area of redness. There is no mode of transmission and cellulitis is not contagious. Folliculitis is an inflammation of the hair follicles. This is typically from a bacterial infection. Common sites include the chest, face, axilla, buttocks, groin, and legs. The S. aureus bacteria can occur when shaving with a razor blade. Possible opening in the skin from nicks from shaving can allow the bacteria in. It can also be caused by friction as well. There is no skin-to-skin transmission. Pseudomonas aeruginosus, or hot tub folliculitis, is from a poorly maintained contaminated water. There is no skin-to-skin transmission. Signs and symptoms of S. aureus are small, tender, red papules or bumps, which can occur in multiple areas. Pseudomonas aeruginosus is red, itchy papules, most commonly under the areas covered by swimsuits. Folliculitis is not contagious and therefore does not have a mode of transmission. Furunculosis is deeper in the hair follicle cavity. The S. aureus bacteria can contain strands of MRSA and can be difficult to treat. A furuncle is a type of furunculosis that is similar to folliculitis, which is a boil or abscess-containing pus that develops in a pre-existing site of folliculitis. More commonly, after puberty, these sites occur with trauma or friction at the waistline, belt line, axilla, groin, thighs, and buttocks. A carbuncle is a type of furunculosis. It is a collection of several furnicles. They are common among wrestlers and can be transmitted from skin-to-skin contact. Signs and symptoms begin with tender, deep, firm papilla that enlarge and become painful. They may fluctuate over a period of days. Abscesses remain deep and reabsorb or drain through the skin. Acne is a condition affecting the philiobasis unit that causes inflammatory lesions. The appearance is red papules, pustules, or deep cysts. They are typically non-inflammatory lesions, blackheads, or whiteheads. The transmission, acne, is not considered contagious. A purunkia is an infection affecting the proximal and lateral nail fold that separates the nail from the skin. Signs and symptoms include bright red swelling in the folds of the tissue surrounding the nail. Purunkias are not contagious, but if they are draining, personal protective equipment should be used. An onychia is an infection of the nail matrix. Signs and symptoms of an onychia include a purulent look underneath the nail. It can also look like pus underneath the nail. Onychias are not contagious, but if draining is occurring, personal protective equipment should be used. Herpes simplex is a viral infection. It presents as cold sores, fever blisters, genital herpes, and herpes gladiatorium. It is transmitted through skin that has been previously injured, such as cuts, abrasion, and damage. Treatment includes oral antiviral medication, including aclovar, valacovlar, flamaclovlar. Athletes should be withheld from sports until they are asymptomatic. 22% of people who are 12 or older are infected with the herpes simplex 2 virus. 80 to 90% of the population have herpes simplex 1, which is commonly chickenpox. Signs and symptoms include flu-like symptoms, fever, sore throat, malaise, vesicles on the erythematous base, grouped vesicles in the same shape and age, tingling and pain occasionally, and they are usually reoccurring. Varicella is also known as chickenpox. It is a common childhood disease. It is transmitted through respiratory droplets or skin-to-skin contact. Patients are contagious 2 days before symptoms have appeared and until all lesions have crusted over. Treatment includes lotions, antihistamines, and antibiotics for secondary bacterial infections. Signs and symptoms include low-grade fever, headache, malaise, papular or vesicular rash. Lesions will vary in size, shape, and age and will rupture and form crusts. Varicocele is extremely contagious and should be treated as such. If an individual does not have chickenpox as a child but gets the disease in older age, this can actually turn into shingles, which can be very, very painful. It is recommended for people who did not have chickenpox as a child that they get the shingles vaccination. Herpes zoster is also known as shingles. Shingles is a reaction of the herpes zoster virus involving the skin along the dermatological distribution. Shingles may occur as a result of advanced age, immunosuppression, lymphoma, stress, and radiation therapy. Treatment includes high doses of medication that should be given within 72 hours of onset, narcotic analgesics. They should be withheld from play, physical activity, and physical contact with others until all lesions have crusted so that they do not receive a secondary infection. Signs and symptoms include pain, tingling, burning, and itching. Symptoms may mimic myocardial infarction, pleurisy, acute abdominal pain, and migraine headache. Patients may also have preceding outbreaks of fever, malaise, headache, and lymphadenopathy. Herpes zoster is extremely contagious and therefore the mode of transmission is high. Musculum contagiosum is a disease of the skin and mucous membranes which is caused by the pox virus. Signs and symptoms are characterized by small, smooth, flesh-colored toned, or white dome-shaped papules with a central point. They may be red, inflamed, or small and itchy. The mode of transmission is spread by direct contact from person to person and through contaminated objects. The human papillomavirus, or HPV, is a DNA virus. It is an infection of the keratinocytes of the skin or mucous membranes. Usually it results in warts on the hands or feet. There are 65 different types of the HPV virus. Signs and symptoms include small, smooth, skin-colored papules that may progress to a rough surface. They sometimes have a flat top surface. The mode of transmission is skin-to-skin contact and can occur at sites that have trauma, abrasions, or eczema. Tinea corpus is a common fungal infection characterized by scaly, erythematous lesions on the skin or ringworm. Signs and symptoms are scaly areas that vary in size. They may be itchy or they may be asymptomatic. Mode of transmission is high through skin-to-skin contact. Tinea curis is also known as jock itch or ringworm of the groin. It is an infection of the groin area caused by a fungus. Signs and symptoms include red, raised, scaly patches that may blister or ooze. Patches often have sharply defined edges. Patches can be redder around the outside with normal skin tone on the center. In abnormally dark or light skin, sometimes these changes in pigmentation are permanent. The mode of transmission for Tinea curis can be triggered by friction from clothes or prolonged wetness in the groin area, such as from sweating. This can be passed from one person to the next by direct skin-to-skin contact or contact with unwashed clothing. Tinea unguenum is often referred to as onychomosis. It is an infection of the nail tissue of the hands or feet. There are possible 7 signs and symptoms which include infected, thickened, cloudy, brittle, brown, lifted nails, and destruction of the tissue underneath the nails. The mode of transmission for Tinea unguenum occurs by a transmission of an infectious agent by one person to another through one or more of the following: saliva, air, coughing, fecal-oral route, surfaces, blood, needles, blood transfusion, sexual contact, or mother to fetus, among other modes of transmission. Tinea pedis is athlete's foot. It is an infection of the feet caused by a fungus. Athlete's foot may last for a short or long time and may come back after treatment. The most common symptom is cracked, flaking, peeling skin between the toes or on the side of the foot. It may also include red and itchy skin, burning or stinging pain, blisters that ooze or get crusty, and if the fungus spreads to the nails, they can become discolored, thick, and even decay. Athlete's foot may occur at the same time as other fungal skin infections such as jock itch. Athlete's foot is the most common type of tineal fungal infection. The fungus thrives in warm, moist areas. Athlete's foot is easily spread and can be passed through direct contact or contact with items such as shoes, stockings, and the shower or pool surfaces. Tinea capitis is a fungal infection of the scalp. It is also called ringworm of the scalp. Signs and symptoms include bald patches with small black dots due to hair that is broken off, scaly areas of the skin that are red and swollen, pus-filled sores called keratins, low-grade fever around 100, swollen lymph nodes, itchy scalp. The modes of transmission or causes are most likely mold-like fungi called dermaphytes. The fungi grow well in warm, moist areas. It is not uncommon to have minor skin or scalp injuries. This can also happen in people who do not like to bathe, like teenagers. It can also occur if you have a wet scalp for long periods of time or a sweaty scalp for long periods of time. Tinea vesicolor is a fungal infection of the skin. It is caused by the type of yeast that naturally lives on your skin. When the yeast grows out of control, the skin disease, which appears as a rash, is the result. Signs and symptoms include patches that may be white, pink, red, or brown and can be lighter or darker than the skin around them. Areas that do not tan, most commonly seen on the neck, arms, and hands. Modes of transmission or causes can include if you have oily skin, hotter climate, if you're sweating a lot, if you have a weak immune system, basically if you live in Corpus Christi you have a higher risk, it's not contagious, and it usually affects teens and adults. Head lice are parasites that are found on the human head. They are spread by person-to-person contact or the sharing of combs, brushes, caps, and other clothing. They are common with preschool and school children. Up to 1 in every 10 children in school acquires head lice at some point. Signs and symptoms include tickling or feeling like something is moving through the hair, itching caused by an allergic reaction to the bites, sores on the head. Sores on the head can sometimes become infected. The mode of transmission is contact with an already infested person, wearing infested clothing, and head lice are most frequently located on the scalp behind the ears near the neckline at the back of the neck. Body and pubic lice are blood-sucking insects. Lice are 1 to 3 millimeters long that have 3 pairs of legs that end in powerful claws. Females live for 1 to 3 months and can lay up to 300 eggs. 3 species of lice have adapted to live on humans: head louse, crabs, and body or pubic lice. Signs and symptoms include diagnosis that is based on finding adult lice or eggs, red itchy papules or itching that is worse at night. Blue macules may be visible at the feeding sites. Minute dark brown specks of lice excreta or lice poop are sometimes seen in the skin and underwear. Modes of transmission is person-to-person contact. Scabies are an infestation of the skin by a human itch mite. Microscopic scabies mites burrow into the upper layer of the skin where it lives and lays eggs. Signs and symptoms include intense itching, pimple-like skin rash, and the mode of transmission is direct, prolonged skin-to-skin contact with a person who has scabies. Chigger bites are tiny members of the arachnoid family. You probably won't see them. However, their bites pack a powerful punch. Signs and symptoms include intense itching and a desire to scratch. Bites can appear in clusters and can form a rash. Chigger bites in the male genitalia can cause severe itching, swelling, and painful urination. Modes of transmission: chiggers live in tall weeds and grass, sometimes in berry patches and in wooded areas. These chiggers quickly attach to your skin if you walk by or brush up against vegetation. They are temperature sensitive, so if the temperature is below 60 degrees Fahrenheit, the chiggers become inactive. If it's below 42 degrees Fahrenheit, chiggers die. We can see that chiggers live mostly in the southern part of the United States. Texas is among that. A leukoplakia or keratosis are thickened white patches. They form on the gums, inside the cheeks, at the bottom of the mouth and tongue. Patches cannot be scraped off. Signs and symptoms include white or grayish in patches that can't be easily wiped away. They may be irregular or flat in texture, thickened or hardened in areas. They may also be associated with red raised lesions or erythroplakia, which is more likely to show precancerous changes. The cause of leukoplakia is unknown. Tobacco use, including smoking and chewing, appears to be responsible for most cases. Squamous cell carcinoma is a common form of skin cancer. It develops in the thin, flat squamous cells of the outer layer of the skin. Signs and symptoms include a firm red nodule, a flat red sore with scaly crusts, a new sore or raised area in an old scar or ulcer, a rough scaly patch in your lip that may evolve to an open sore, a red sore or rough patch inside your mouth, a red raised patch or wart-like sore in or on the anus on your genitals. The mode of transmission is prolonged exposure to UV or ultraviolet radiation, most commonly from sunlight or tanning beds or lamps. Kaposi sarcoma is a cancerous tumor on the connective tissue. It is often associated with AIDS. Signs and symptoms include a blue, red, or purple bumps on the skin, which are rich in blood vessels. Lesions may first appear on the feet, ankles, thighs, arms, hands, or face. Other symptoms may include bloody sputum, shortness of breath. Modes of transmission in people with AIDS, Kaposi sarcoma is most commonly caused by an interaction between HIV, a weakened immune system, and the human herpes virus 8, or HHV8. Kaposi sarcoma has been linked to the spread of HIV and HHV8 through sexual activity.